My name is Brett Bymaster. I'm Executive Director of Healing Grove Health Center. And I have here with me Dr. Cheryl Ho, Dr. Angela Bymaster, and Dr. Thomas Stafford. And so I'm going to ask if Dr. Cheryl Ho, if you'd be willing to open us up in prayer.
So Jesus, we come before you and say, God, you are the one that is in control. And we thank you for this gathering of pastors and church leaders here. And God, we thank you that you are our Lord, and that together, Lord, that we just say that we are here to do what it is that you ask us here to do on this earth. And so we just say, bless this time, and may we all learn and fellowship together. In the name of Jesus, amen.
Amen. So just very quickly, Dr. Cheryl Ho, say hello.
Hi.
And Dr. Angela Bymaster, say hello. So Dr. Ho and Dr. Bymaster will be the Healing Grove staff physicians. And then for those who weren't on earlier, we have Dr. Thomas Stafford, if you can say hi.
Hello.
Who is on the board of members for Healing Grove and is a physician in Rockland, Sacramento area. So we're going to go ahead and start with our presentation. So let me just get that started here. Hold on just a second. Okay, so Healing Grove Health Center is a new Christian healthcare startup. So we are looking to change the healthcare paradigm from just going to visit the doctor to actually achieving holistic wellness. And we want to do that through place-based community care and faith-based community care. So our mission is to share the love of Jesus through healthcare, soul care, and culture care in order to bring the healing of the nations to our community. And the healing of the nations there is from Revelation 22, this beautiful prophecy that there would be trees, the leaves of which bring healing to the nations. And so that's our hope, is to bring the healing of the nations here to our community in San Jose. It's worth saying that there is no Christian healthcare in Silicon Valley after O'Connor Hospital closed. So we will be the only Christian healthcare. And we're really excited, and we think that God has brought us up for a moment such as this. We think it's really important to have Christian healthcare in our community. We'll talk more later about how Healing Grove works. If you want to stay up to date with the things that we're talking about, I encourage you to go to our website, healinggrove.org/coronavirus. And as we go through this presentation, I would encourage you to use the Q&A feature and ask questions. If you have a question, just go ahead and type it in. We might answer it later on, but it's worth just having it registered there. We're going to do about a 30-minute presentation, and then we'll have time at the end for Q&A. And we'll make sure we get all your questions answered by our physicians. So with that, I am going to go ahead and turn it over to Dr. Cheryl Ho, who's going to lead the next section.
Hi, so great to be here with you guys. So just a roadmap of what we're going to talk about today. I'm going to talk a bit about epidemiology, which is a fancy word for statistics and transmission. Dr. Stafford is going to talk about prevention of the coronavirus, and Dr. Bymaster is going to talk a little bit more about the disease itself, what it looks like, how it gets tested, and what are the treatment options that we have. And then Brett here is going to talk about, as Christians and as churches, how might we respond to the coronavirus. It's a little bit about myself. I work here in San Jose at Valley Medical Center. I'm board certified both in internal medicine and addiction medicine. I'm also a pastor's wife to Douglas too, who is a pastor at San Jose Christian Alliance Church and our church plant, New Vine Community Church. So as I said, we're going to start here on this part that I'm going to talk about. So just as a framework, before we kind of dig deep into coronavirus and what that is, I want to just set the stage for you all to understand really influenza, or just what we think of normally as the flu, and its differences between what we see now, what we're all concerned about, which is coronavirus. And so I just want to put out there that every year, 300,000 to 600,000 people die from seasonal flu every year. I mean, that's a staggering amount. And that's something I think that we don't really highlight, especially in these discussions around coronavirus. And to just put things in perspective, as of today, there are only a few more than 3,000 deaths from coronavirus, and this is worldwide. And so, I mean, we can just see that right now there's a huge discrepancy in the burden of disease, that seasonal flu is way more deadly in terms of the number of people that it reaches compared to the coronavirus. Just in the US alone, at this time point, it's been a pretty bad flu season. 16,000 have died already this year from the flu. So really the overarching message that we want to give today is don't panic. And I know that, you know, that is what a lot of folks have been trying to convey, but that is also our message as well. And again, what I want to point out are the differences in the death rates between influenza, coronavirus, and then there was this kind of flu to end all flus that happened in 1918 called the 1918 pandemic. So what I do want to point out really, and so what our goal here is to share, you know, facts versus hysteria. So in terms of influenza, if you look here at the death rates and you compare across the spectrum here, so 0.1% of people who get the flu actually die from it. It's a pretty low number, but because so many people get the flu, that number is big, but the percentage of those infected is quite low at 0.1%. Now, when we're talking about coronavirus, I think this is where people start to get a little bit nervous, because if you look at the death rate, that can be anywhere from 0.7 to 2%. So, you know, in the kind of statistics that we're getting from China, and I think we all know that, you know, the statistics there can be a little, we're not sure about the validity of those statistics. We're hearing that the death rate is around 2%, but outside of China, we're seeing that the death rate is about 0.7%. So yes, higher than influenza, but still a pretty low number. And I have to say, even that 0.7% number, it's not totally accurate, because we're not actually totally capturing all of those people that have the virus. So I suspect that actually that death rate is going to be even a lower percentage than that 0.7%. And comparatively to the 1918 pandemic that was just wiped out, I think close to like 500 million or 50 million people, that was a greater than 2.5% death rate. So if you look at the percentage of people that died of coronavirus, it is like a fraction of 1%. So it's serious, but really not necessary to panic. I have here on this slide, on the left side, characteristics of influenza, and on the right side, characteristics of the coronavirus. So for influenza, we can see that, you know, on the left under symptomatic illness and medical visits, a lot of people do get sick, but the people that get hospitalized and die tend to be the elderly. So those 65 and older. So on coronavirus, we are also seeing that the older age as well are the ones that are getting the most complications. So when you hear of the deaths, you know, of those from the ship, the cruise ship, as well as the ones in Washington, they tend to be older, as well as people who have had a number of medical conditions. So people that are already sick to begin with. Other interesting things that we're seeing, a little bit slightly higher prevalence in men more than women who are getting the severe illness. And a surprising thing is that the children, normally we're familiar with kids getting flu, but in coronavirus, we're seeing that kids are either not getting the infection or they're getting a less severe version of it. So that's something interesting that's a little unique about the coronavirus that we're witnessing. How is it transmitted? We presume, based on the characteristics of other corona type viruses, that it's what's called to be respiratory droplets. We have that picture there of, you know, when you sneeze, kind of germs go everywhere. And so that's presumed to be how it's spread. Kind of the distance, you know, at which, you know, I guess safety is around 6 feet is really thought to be. But what is, I think, causes people some concern is that even if, so it's known that if you have symptoms, you can spread the disease. But we have also learned that from the coronavirus, even if you do not have symptoms, you're also able to also spread the disease as well. And I think that's what's concerning to a number of individuals. What's also concerning is that you can find the virus in both the blood as well as bowel, you know, stool specimens. It's not clear whether those are transmission agents. So it's really unclear, you know, and I think that, you know, most likely it is respiratory droplet, but there's also a couple of different features that make it a little bit different than what else that we've seen so far. Hand it over to Dr. Stafford.
All right, thank you, Cheryl. So I'm Tom Stafford. I went to medical school out in Boston at Tufts University. And I did my residency back near where I grew up in Southern California at USC. I am a pediatrician and an internist and board certified in both. And I spent some time in medical school studying faith and medicine at the Institute of Faith and Medicine in Boston. So next slide. So I'm going to talk about prevention. Next slide. So my wife saw this on Facebook yesterday, and I thought it was a pretty good recommendation. It says, wash your hands like you've been chopping jalapenos and you have to remove your contact lenses. It's kind of a funny little slide, but there's a lot of truth to it. That if you just imagine that you've got something like jalapeno peppers on your hands, those are the types of things you should be doing with your hands. Don't touch your nose, don't touch your mouth, don't touch your eyes. You wouldn't do that if you had something hot and spicy on your fingers. And like Cheryl was saying, as far as coronavirus goes, people can be asymptomatic and the droplets can spread the virus around and it can be on your hands. So you don't want to touch your nose, eyes, or mouth. You can go to the next slide, Cheryl. Washing your hands obviously is helpful. You want to wash with soap and water for at least 20 seconds. If you don't have access to a sink, then hand sanitizer, at least 60% alcohol is helpful. Make sure that you are frequently cleaning and disinfecting surfaces and objects that are frequently touched. We'll talk a little bit more about that as we give recommendations for your churches on cleaning. But if you just think about it for a minute, things that we touch frequently and a lot of people touch frequently are doorknobs, tabletops, countertops, the handles of cabinets, anywhere where people are going to be passing through and lots of people are going to be touching them. And if you're caring for a close contact, someone at home, then it is best to have them in their own room. And if you're going to go into their room to care for them, that would be an instance where you would want to wear a medical mask. There's a lot of confusion around masks with coronavirus. The standard medical masks are helpful in preventing infection because it is spread predominantly through respiratory droplets. The CDC, the WHO, they do not recommend that people wear masks out in the general public unless you yourself have symptoms that resemble coronavirus, and I'll get to that soon. And they also do not recommend wearing an N95 respirator mask, which are the masks that you can buy at like paint stores that filter out small particles. So next slide. So the CDC, at least and the WHO, have put out maps of where the burden of the disease is most heavy. And the CDC has put out travel guidelines. They recommend avoiding all non-essential travel to China, to Iran, to South Korea, to Italy. And if you have medical comorbidities like asthma, heart disease, then also Japan as well. Next slide. As far as protecting other people, things that you can do to protect other people, there's no need to cancel large gatherings at this time. So that would be schools, festivals, church gatherings. There is no recommendation to do that, but you do want to monitor the CDC recommendations, the Santa Clara Public Health Department recommendations, because that may change, although it's not the case at this time. For protecting other people, if you are sick and you have symptoms of what we call a lower respiratory infection, fever, cough, difficulty breathing, then wearing a medical mask like this gentleman in the bottom left there, that's your standard medical mask. That is a helpful thing to help prevent the spread of infection. You want to make sure that you're washing your hands if you're sick. And I put a picture of the N95 mask up there. Those are masks that are not being recommended. So there's no reason to wear those. And then obviously this is a big one. It's hard for some people, for most of us, myself included. But if you are sick, if you have any symptoms that resemble the coronavirus, fever, cough, difficulty breathing, then you want to stay home. and only leave your home if you're seeking medical care. And when you do seek medical care, if you can call in advance so that they can prepare for you to come, that would be helpful. Next slide. So a big question is, what should you do at your church for helping prevent the spread of infection? If your church is anything like the church where I go to, most of these infections are spread in the nursery and the kids ministry areas. Keeping kids home from church if they're sick is really important. I know how difficult that is. I have a 3-year-old and I have a 5-year-old, and it seems like my 3-year-old's nose is running all the time. So if they seem like they're starting to get sick, starting to have a fever in particular, then it would be a good idea to keep them home. I looked for a list of cleaning products that kill coronavirus, and there is a list published. There's too many of them for me to go through them one at a time, but there's a web link up there, and even if you just Google American Chemistry coronavirus, that link will come up as the 3rd one from the top. And there's a whole list of 100 products that can kill the coronavirus to make sure you're using the right thing. And again, these are all pictures of things you would want to sanitize. You can go to the next slide. So this probably will take some extra doing at your church, putting extra hand sanitizer around the church, with the kids ministries, when the kids come in, when they go out, make sure that you have the staff are sanitizing their hands. Coronavirus is probably going to be around for a while, so planning on extra janitorial service to help clean the church, and it'll probably last for months. It'll be helpful to your congregants to know that you're doing this and comforting to them, so a reminder to let them know that you're being proactive about that, and make sure your janitors aren't sick, because they should be staying home as well. And I'll pass it over to Dr. Bymaster.
All right. Thank you, Tom. So this is me. I went to University of Iowa for medical school. I was at residency at O'Connor Hospital here, and I'm in family medicine. And I think that's all we need to say about that. Okay, so we're going to talk about clinical features, testing, and treatment. It is important to think about where you're getting your news from. There is a lot of very exciting news that comes out that makes everyone feel like it's the end of the world, and I think maybe keeps ratings high, but it's helpful to look at the public health department and the CDC, because we know that their information is going to be really, really accurate, and that's where we're getting all of our information. So just as people from your congregations may be getting their news anywhere, and I just know there's a lot of reasons to panic from the news, but maybe they aren't entirely necessary. So if someone has a coronavirus, they have a fever, pretty much everybody with coronavirus that is being tested has a fever, and we'll talk about that in a minute, cough, and then sometimes shortness of breath if it's getting more severe. Over 80% of cases, which again, these numbers are a little bit hard to come by because we're not testing asymptomatic people, meaning people without symptoms, but among people who are being tested for coronavirus, almost all of them are getting just mild disease. As Cheryl mentioned, elderly and chronic patients with chronic diseases are affected the most, especially if they have a chronic lung disease, like someone who's maybe smoked for a very long time and has COPD or something like that. And males are affected a little bit more than females. It's not a ton different, but there's a little bit of an increase there. So for the diagnosis, we have one test in America. And it is being limited in terms of who can test with it and how many tests we can do. So it's very, very, and I'm going to have a whole nother slide on this, so just hold on and I'll talk more about the test. But if someone has a mild case of coronavirus, it will either be just that the doctor will say you have a virus and we don't know which one it is, or they'll say, well, maybe it's coronavirus, but we can't know because we can't test it. So we call that a clinical diagnosis, where the doctor just decides that it might be that. Honestly, if you have a mild version of coronavirus, it kind of doesn't matter because you will get better. So there is no cure, there's no medicine, there's no Tamiflu or something like that that we can give for coronavirus. And there's no vaccine currently, although I know lots of people are working on this. So I expect that we will have one eventually. But as of right now, it's all supportive care and symptomatic treatment. So it's the usual. For when you have a virus, it's your chicken soup and get some rest and drink some fluids and take some Advil and, you know, Tylenol or whatever, lots and lots of fluids and rest. So here's the testing, the long story, that right now in Santa Clara County, the health department is in charge of the testing. So if I have a patient who I think has coronavirus and I think it's severe enough that I really want to know, and then I call the health department and I say, hey, this person has really bad fever, really bad cough, it's really lower respiratory, I think they may have coronavirus. Then the health department will interview the patient and determine if they agree that the person should be tested. And then they will actually physically come, they'll send a team, and they will actually do the swabs and everything and manage all the testing themselves. So it's a very complicated scenario in order to get someone tested, but it can happen if needed. And so it seems that the US is kind of rationing their tests. It seems like we don't have a lot of tests. I don't know their whole thought process, but the point is, it's not easy to get tested. We do know there are a lot of cases in Santa Clara County. By the time you have severe illness, you also have mild illness. So if you are sick, if you have a mild illness, just stay home, get, you know how to eat chicken soup and get rest and all of that at home. If you are sick, don't have an elderly person visit you or someone who recently had a kidney transplant or some kind of immunocompromised condition. Like, it's not a good time to hang out. If you have a moderate illness, then stay at home and keep watch for worsening symptoms. So we do want to catch it early if it becomes severe. If your family is, if your kid's coming over to talk to you, put a mask on so that you're not going to spread it, and then call your doctor if you notice the fever is worsening, this really deep pulmonary infection, a really deep cough, and of course, difficulty breathing is a big problem. If it's severe, go to the doctor or the hospital right away. And anytime you go into public with symptoms that may be coronavirus, just put on a mask if you're going to the bank or something. We don't want to be spreading it around.
Okay, thanks, Dr. Bymaster.
Brett.
So my name is Brett Bymaster. I'm the Executive Director of Healing Grove Health Center and former youth pastor at the River Church in San Jose. So I want to talk about how churches can respond. So first of all, I think it's really critical that churches communicate clearly with every channel they have, from the pulpit, from their social media feeds, and from their weekly e-newsletter. So because there is so much, I think, in the news, it's so over amplified. It feels like it's time to panic, and we know that like Costco's are selling out. I think what we want to communicate really clearly is that this is something that needs to be taken seriously, but it should not be cause for panic. In other words, it's a big deal, but it's not, again, it's not the 1918 pandemic. We don't expect for there to be like mass casualties at this point. And then the third thing is, I would encourage churches to communicate across all their platforms about how Christians should think and act during a pandemic, because we really should act differently than others. And so I think that's maybe the most important thing. One simple change that you can make in your worship service is to think about different ways to do communion. Again, this might be overkill, but it's a way to communicate to your parishioners that you're taking this seriously. So Dr. Cheryl's church is using these pre-packaged communion elements that are more sanitary. And then you can think about like, having everybody use hand sanitizer when they walk in, having your greeters use hand sanitizer regularly. Think simple changes like that. So we just want to emphasize again that you should not cancel anything right now. Your small group should not be canceling, your church should not be canceling, your youth group should not be canceling, but it is possible that will happen. And I think you should probably in this week's staff meeting plan for what that would look like. If you're already live streaming, then that's great, because you can live stream if your church gets canceled. If you're not live streaming right now, I'd encourage you to learn how to do that. You can actually do pretty decent live streaming with an iPhone. Put an iPhone in front of your stage and, work on your lighting a little bit. Also, you want to think about how that's going to affect non-techie people. Think about how you'll handle your budget if you have to cancel church. I think it's particularly critical to think about how you'll keep discipleship going, because we don't want to have, like, sometimes it's possible that if there's a significant overreaction, we end up closing everything, schools close, businesses close. People could experience like some pretty significantly negative impacts from loneliness and being alone and from fear. So I would think about now, could you have Zoom accounts set up so that all your small group leaders can hold small groups through Zoom? And then consider, what would it be like if there is an opportunity, if schools were to close, how could you have families capitalize on that to do Christian education from home? So last, I want to talk about what might a theological response to coronavirus look like. And I'm really hoping that this can be something that you can use in your sermons and your messages this Sunday. I think the best passage is from Luke chapter 5. And I have here a picture of a person with leprosy. And, when you see a person with a really contagious skin disease, the first thing you don't want to do is to touch the person. And that is exactly what Jesus did. Jesus reached out his hand and touched the man before healing him. It would have made a lot more sense to touch him, to heal him first and then touch him. But Jesus chose, I think, very strategically to touch this man in his state of disease, to bring him dignity, not after he got healed, but while he was still sick. I think that shapes the way we think about how do we respond to these things. In the next vignette, it's the paralytic drop through the roof, and Jesus is clear about why he heals the paralytic. He heals the paralytic so he can show that the Son of Man has authority specifically to forgive sins. And so there is this connection between healing and the forgiveness of sins. I think we have to respond to this not out of fear, but out of power and love. And specifically when we pray, I think our inclination is to pray for safety. And while I think there's a place for that, we know the disciples, after Peter got out of prison, the first thing they prayed for was not safety. In fact, you won't find a prayer for safety in the book of Acts. The disciples prayed for boldness in the face of danger. And we know it was dangerous. People like Stephen and others were murdered. So I think there's an opportunity here for us to pray in boldness, out of power and love and self-control. And that really comes out of this deep sense that even if this pandemic were incredibly deadly, even if a lot of us were going to die, that our salvation is set. Our salvation is fixed. And so we can have this deep sense of confidence and boldness. And that confidence and boldness should drive us to be the ones who are caring in the midst of disease and hurt. And, we have such a rich tradition in cases of pandemics of Christians reaching out. So, for example, the Alexian brothers in Belgium in the 14th century, when the Black Plague hit, they chose not to run away from the plague, but to run towards the victims of the plague
1 p.m.
and provide them treatment. So here's Alexian Hospital in San Jose, which came about from the Alexian brothers as a legacy of that. Unfortunately, Alexian's no longer a Christian hospital. Now it's regional. And in fact, all three of our major private hospitals were Christian in San Jose, and they're now all secular, which I think is a great loss to our testimony. I want to call out examples of people who are doing this currently. So Dr. John Fankhauser was the chief medical officer at Valley Medical. During the Ebola crisis in Liberia, he went to treat people along with Marit Dorado, who's the mother of swimming Olympian Maya Dorado. Both of them went to Liberia to treat people. And I want to just show a quick 2-minute video here about what it looks like to be people who act in boldness.
When a disaster comes to the place where you are, you can either choose to flee or to stay and respond to it. I went to Liberia in the first place to serve the people of Liberia and West Africa. An Ebola outbreak didn't change that purpose. In fact, it emphasized it a little more.
We first heard about Ebola in Liberia in March.
I was actually at a picnic and somebody said, "Have you heard that there's an Ebola outbreak in Guinea and it's spread across the border to Liberia?"
One of our doctors was very concerned about the possibility of it coming to our mission hospital. She felt that we should prepare an isolation unit, not so much in case we had Ebola, but when we received an Ebola patient.
My choice to stay in Liberia and take care of patients with Ebola and help fight this outbreak is really a natural response. The day I found out that I had Ebola, it was a Saturday. It was July 26th.
It was on July 22nd, the last day I went to the isolation unit. Wasn't feeling really great, but it felt very much like malaria. So for the next 4 days, took malaria medication.
I was lying in my bed in my house where I had been quarantined, and Dr. Lance Plyler, who is the disaster response team leader for Samaritan's Purse, was standing outside my bedroom window. And Dr. John Fankhauser, one of my colleagues and friends who was caring for me, was in my room with me in full PPE. And Lance said, "Kent, bud, we have your test results, and I'm really sorry to tell you that it's positive for Ebola."
So, these are powerful examples of people who took their lives in Christ so seriously that they ran towards the Ebola crisis, knowing that they could well die. Thankfully, both of the people in that video were able to recover from Ebola, but I think that sets a powerful legacy. I would encourage you to show that video in your worship service this week and think about how you can frame this as an opportunity for people to practice boldness in their Christ following. Like I said, up until now, there is no Christian healthcare organization in Silicon Valley, and I think that God is calling us to begin Healing Grove Health Center for such a time as this, as we grapple with this crisis that's striking us right now. So I'm going to share just for a minute about how Healing Grove Health Center works. So we're just starting. In fact, we got the keys to our facility today. We just signed the lease, which we're really praising the Lord for. We'll be doing construction for the next 4 or 5 months. I'll talk about that in a second. But we are starting pre-enrollment right now. So we are seeing patients right now through telehealth and home visits, which is particularly important during the coronavirus epidemic. So if people are really worried and they want a Christian doctor who's going to pray for them and really care for them and give them personalized care, Healing Grove Health Center right now is a great fit. We are accepting memberships right now. The way Healing Grove works is people pay about $200 a month for care at Healing Grove, and each paying member funds 2 low-income uninsured members, which we think is what the kingdom of heaven looks like. For churches on the line, we want to partner with you. We have a whole bunch of different ways that we're excited about partnering with churches, including doing events like this. Our doctors will be happy to come to your church and talk to you about sickness or mental health, or about how the spiritual connections between physical health and spiritual health. I should note that we have Dr. Ho and Dr. Bymaster and myself here. We have one more staff member who's a really critical part of our team, Lourdes Sarmiento, who is our Spanish-speaking pastor who will be full-time staff at Healing Grove. This is our future home, which we just got the keys to today. As you can see, it's got a lot of work to do, so we'll be building for the next, about the next 5 months before we open our facility. But in the meantime, we are taking memberships. And like I said, we'll be doing those memberships through our app. We have a telehealth app that we'll offer, and doing home visits. And home visits are free during that pre-enrollment membership time. We will operate in downtown San Jose in the Washington community. You can see pictures of where we are there with easy parking and easy access off the freeway. We're in the midst of a capital campaign. We would love to invite you, if you're interested in being a part of the amazing things that God's doing through Healing Grove Health Center to provide healthcare, both to the uninsured and kind of better off, and to the low-income residents in our community who struggle to afford healthcare. This is a great way to get involved in that. So with that, we are going to end the normal part of the presentation, and we're going to take questions and answers. Doctors, let me tell you the questions that we've gotten so far. So the first question is about someone who came in for an ear infection.
Yeah, I can take that one. The question is that there was a patient who apparently had an ear infection, but also a lot of the same symptoms of the COVID-19. And they, it seemed like the health professional just said that you have an ear infection, and they did not do additional testing. And so I think what happened here is when we talked about mild illness being presumptive clinical diagnosis, I think that probably the person said, well, I don't have access to testing for coronavirus if the person does not have severe disease at this point. So I'm assuming that's probably what happened in that situation.
I think it's really unclear what the mild disease form looks like. And because we don't have enough testing opportunities in the US, whether or not the clinician thought it was or wasn't coronavirus, that's just not, people aren't able to be tested at this point unless you meet specific criteria, like Dr. Bymaster said, of the fever and lower respiratory symptoms.
It is also possible to have two things at once. So the person could have an ear infection and coronavirus. However, ear infections are treatable. Coronavirus is supportive care. So I think the doctor was probably thinking, well, what can I actually treat here? So.
Yes, we will send the presentation to everybody, and also the recorded version. So Deborah Wu asked about tips on, there's quite a few questions on hand sanitizer. What's the best kind? Like there's kind of like a light sort of hand sanitizer for kids. Can you give recommendations on what we need in hand sanitizer?
Tom? Oh,
Tom, you're muted.
You're muted.
Okay, so yeah, I can start with that. I tried to answer her through the chat. So the Baby Ganix is great. I used it for my kids. It's gentle. I love it, but I'm not going to use it for coronavirus. It was actually studied. It has benzalkylonium chloride in it, and that does not always kill the coronavirus. It's not completely effective at killing it. The things that have been shown to be completely effective is the greater than 60% alcohol-based sanitizers, soap and water, which if you're looking for something gentle, soap and water is probably the most gentle thing you can use, or the bleach-based wipes. So for sanitizing kids' hands, those are the three things that I would recommend.
And Tom, you can correct me if I'm wrong. My understanding is that soap and water is actually the best. Is that correct?
Yes, absolutely.
But
Yeah.
20 seconds of washing is quite long.
So I think they say to sing happy birthday to you for a few times. I don't remember exactly how many times, but for the hand washing, what it is because you're mechanically getting things off of your hands versus when you're hand sanitizing, you're just kind of putting some chemicals over. And so that's really the difference.
Okay, this is a great question. This Sunday, we will have a program with middle school families visiting homebound seniors in our congregation. Would you cancel this or not? That's a great question. And I think this is one of those where a lot of people would do different things with it. There's a benefit to visiting homebound seniors, right? These are people who are very often very isolated, and that in itself can cause all kinds of problems, detriment to their spiritual health and their physical health. And so canceling that is not without its own risks. Going definitely has risks. Some of these kids could have coronavirus and be asymptomatic. Obviously, you wouldn't bring a sick middle schooler with you to a homebound visit, but I would lean, in my own personal opinion, I would lean towards still going. What do you think?
I think you're right, Dr. Bymaster. We are going to have different opinions here. I think I might lean towards potentially not going, but somehow, I don't know, you could sing outside in their windows or bring lots of other things to support. So I think the jury's still out. And I think whenever doctors don't agree on something, that just means there are differing opinions and, it's not a right or wrong.
And I think the one thing I would add is just make sure that nobody goes who's sick. So they have to be very honest about whether they've got a runny nose, whether they've got a sore throat, any sort of upper respiratory, lower respiratory infectious symptoms, then they should not go.
That's right.
And that would be true anyway.
I love Cheryl's idea about something that involves more space so that you're not in really close contact with the person might be lovely.
Yeah, because everyone has a window. They could just show up.
Yeah, and I think it is important to remember that sometimes loneliness is a more significant disease than any other disease. And so I think, I think the worst thing we could do is become more isolated than we are currently. So, it seems like some safe precautions would be good. Somebody asked about reusing bulletins. So how long can coronavirus last? Should people shred their bulletins or can they reuse them week to week? Tom or Cheryl, do you have anything?
I read that they do know about copper and steel, 2 hours, that it lasts on copper and steel. The other thing, cardboard, plastic, they were still working on it. Last time I checked up on the CDC website about surfaces and how long the virus lives outside the body. I'm thinking a whole week is probably going to be safe on a piece of paper, but we still are waiting to hear that.
Yeah, and my gut reaction to that is to not reuse it after the same service. A lot of people will take their bulletin and set it back down to be reused. I would not do that. because there might be like respiratory droplets on there if someone sneezed or touched it, that could spread.
Yeah.
Alternative to shaking hands with greeters. Should we do knuckles or
elbow bumps?
I mean, again, what's the trade-off here in a society that's lonely, where a lot of us, especially, I think, it's really important to remember for singles, this is a very lonely world, and there are definitely a lot of singles that the only time they ever get touched is at church, and that was the case for me when I was single. Especially, that's more true for guys. And I remember like old ladies giving me a hug at church when I was in my early 20s, and just feeling like, oh my gosh, it's like water in a dry desert. Yeah. So what do you say to that?
Well, there's always, hands are the worst. Hands are very, very, very bad, because you are going to touch your face. Like, forget trying to not, I mean, you should try to not touch your face, but you will. And it's just such an easy way. So you can either just sanitize the heck out of your hands, continue to add sanitizer frequently, and sort of have a greeter at the door and at the sanctuary and at the coffee, and just constantly giving people sanitizer, and just keep shaking hands. Or you could do something else. There's, everyone knows the elbow bump. That's not going to help your people who aren't being touched very much.
Well, what about, are hugs better than handshakes?
I think they are, because you touch the back of them and they are not sneezing on their own back. But I have no evidence. I just feel that way myself.
I see another question up here. It says, how aware are you of asymptomatic spread of COVID-19? And what would you estimate to be the proportion of asymptomatic to symptomatic carriers? I don't think any of us know the actual percentage, because we don't actually have a knowledge of how many people are there without symptoms, but we do know that spread is actually happening. So it's definitely happening. And I think it's happening more than we realize. I know there's like mass panic out there, but I think, it's happening just like it is the flu, but again, nothing to panic about.
And we do know from influenza that it is very triangular. Like, the tip of the iceberg is deaths, then hospitalizations, and then there's a huge number of milder illnesses. And then even below that would be people who are not even aware that they have it.
And
Another question. Go ahead, Tom.
Sorry, from there, addressing the question of, can you be a carrier without any symptoms? Absolutely, yeah, you can. With most infectious viral diseases, there's a asymptomatic carrier stage before you have any symptoms. So for sure, you can be without symptoms and be a carrier.
So there's a really great question here. If people say we shouldn't have fear, so why not shake hands? I think that's a great question. And I think it's interesting that the Christians who went to Liberia wore the full protective gear and went through the whole kind of safety protocol. And they felt pretty passionate about that, partly for their own safety, but even more so that they wouldn't spread it to someone who's more vulnerable. So I think I think sometimes we feel this tension between science and faith, or between science and Jesus. And I think that tension need not be there. I think that we can both be people of boldness and be smart about it. So I think what that means is we can't let the fear of death stop us from loving people, particularly the sick and the marginalized and the poor. But as we do it, we can do our very best to do it safely for everybody involved. So there's a question, at what point should we consider going online for our services?
So this one's easy. The public health department will make that call, and they're very clear about, right now, no reason to cancel anything. And if they make that call, they'll cancel schools and churches and every kind of group event. And they did that in 1918 in San Jose. And so, if it gets bad enough, then they will.
And they may also close specific areas. Like, there's been a couple schools in Washington that they closed one specific school. So I think that's why it's so important to be watching the public health department and not taking your information from the news. There was another question about, what about church pins? Spray them down. I thought that's an interesting question.
Pins, the ones you write with. I don't know.
What did you say about plastics?
It's longer than 2 hours. Yeah. So it's going to be a lot of work to spray all those pins down.
Bring your own pen.
You can advise people to not use the pins for, I don't know. This is a great question, and I don't know what the right answer is. if you wanted to give everyone some wipes and have everyone help you wipe down all the pins in their row, I don't know. I'm not sure how this would be done easily, but yes, pins are definitely a place where coronavirus could be spread.
Although probably unlikely that it would spread week to week on a pin, right?
Right. It would be.
Yeah, no, it would be between services that it would be the issue.
Yeah. That's right.
You know, and in terms of, I know that we had been talking earlier among our group, and I know that we're going to end our time here pretty soon, but we had talked about precautions in the nursery. I know that, Tom, you had spoken to some of that. We had talked about, you know, do you kind of have a certain set of toys for the first service, another set of toys for the second service? I mean, those are just things to think about.
It'd be nice to be able to boil the toys you can from week to week or something, just to be really sure, because those guys are putting it all up in their mouth and everything.
Yeah, but it's hard.
Another question, what about serving coffee and snacks? I think you just do what you always do, right?
Yeah.
Yeah, I love coffee, so you should continue to serve coffee. You can wipe down, like if it's a coffee thing that you're touching a lot, that would be a great thing for a volunteer to wipe down sort of every 5 minutes during busy times. Just do another wipe down, because that is a high likelihood of passing something along in that area. And then you could have someone with hand sanitizer right next to the coffee station and just encourage people to use it.
Okay.
All right.
Well, we should probably wrap up. If you have further questions, if no church pins, then how about pew Bibles and hymnals? Well, we'll just take our chances with that. So we're going to go ahead and wrap up here. If you have more questions, please feel free to email it. Everybody should have my email address. Again, just stay up to date. Be looking at healinggrove.org/coronavirus. We're updating that every day. And if something happens significant, we'll make sure that it's on there. Feel free to give us a phone call. Our phone number is on the website and in our emails. And that cell phone rings to both Dr. Bymaster and I. And so we will be happy to answer your questions. We want to be a resource for the church, so don't be afraid to call us. We won't charge you if you call. It's no big deal. You can also text that phone number, so go ahead and shoot us a text if you have more questions. And we'd love to encourage your church to get involved. In the mass email we're sending out, there's a list of ways that you can get involved. There's a document that outlines those. We also have a really great benevolence program called the Acts 3 Benevolence Program, where we support your benevolence program by offering healthcare to people in your church or people that are coming to you for help. So we have some great ways that you can get involved. Volunteering. We're starting up a prayer ministry. In the next few weeks, you can be watching out. We're going to have several times where people can come to our center with Sharpies and actually write their prayers into the walls before the walls go up. And then in 10 years after Healing Grove has been around for a long time, you can drive by and say, some of my prayers are in those walls. So I think that's a great way, a lot of great ways for people to get involved. We'd love to be able to partner with you and see Christian healthcare flourish in our community.
And the other final thing I wanted to say was that as things change, we've talked about doing a second webinar at some point. Whether it be, if we hear from you all, there were more people who wanted to be on the webinar and there were unanswered questions, we could hold one pretty soon, but otherwise we'll kind of stay abreast of the information. And if a significant change comes up, we might hold this webinar again.
Yeah. So definitely, if you think you'd like us to hold again, we could even do it next week at this time. So send us an email and let us know. With that, I think I'm going to ask Dr. Bymaster to pray for us, and then we will conclude if that's okay.
All right. Father God, thank you for this time. Thank you for all the people who came and participated and for the great questions. And Lord, we just pray that you be with us. Give us a spirit of boldness and of love and of just wisdom, God, so we can know what to do and how to keep people safe from being sick, but also keep them safe from the isolation and the fear and the loneliness and the panic that's out there right now. Let us be a light, God, for this, for San Jose and for California right now. Be with us as we go. In Jesus' name, amen.
Amen.